Hey guys, it's Straight to You Wellness. In this video, we're talking thyroid, right? Thyroid disease is, in my opinion, one of the most poorly managed conditions in all of healthcare. Very poorly managed. Why? Well, you go in with the classic symptoms. You can't lose weight, so there's weight loss resistance, you're constipated, your hair's falling on chunks, cold all the time, fatigue, you got brittle nails, there's anxiety, there's depression, you wake up tired, you can't sleep, you're checking the boxes. What do they do for you? Chemicals, synthetic stuff. Take this, come back in 6 weeks. Friends, here's what you need to understand about thyroid. If you take anything away from this video right now, understand this key concept that 9 times out of 10, 90% of the time, thyroid dysfunction is autoimmune. It's autoimmune. It's called Hashimoto's. It is your immune system that is the problem. It's not the thyroid. The problem is your immune system. It is your immune system that is attacking thyroid. So if you're on the synthetic stuff, Synthroid, levothyroxine, chemical cover ups, you get about a 10% chance of success. You get about a 90% chance of failure. So we have to look at the immune system most of the time. Now, who am I and why should you listen? We help patients get well from a functional standpoint, not guesswork, not more chemical cover ups, but let's dig, find, and work towards solving the puzzle. Let's fix the problem. If I have a problem with my car, check engine light comes on, do I just slap a piece of tape over it or do I pay a mechanic to look underneath the hood and fix the problem? That's what we need. And so many doctors, this is such a failed condition that is so fixable. It is so frustrating to me. But you have to understand the root cause of this thing. So we have to address gut. We have to address the immune system, take the stress off the immune system. We have to fix things at the cell level. That's why what we do is so unique and different and probably unlike anything you've ever seen or tried before, is because we have to fix the cell. All right. Your cells make up your tissues make up your organs. So if your cells are inflamed, if they're broken, if the receptors are blunted, we can't get the T3 into the cell. T3 is your active thyroid hormone. We can't get that into the cell. You're not going to work. You're going to have the classic thyroid symptoms. So we have to fix the cell, which in turn affects the tissues and the organs. And that's the approach that we take. Works very, very well. So if you're struggling with thyroid dysfunction, what I want to do is offer you a one-on-one discovery call. This is not a pushy sales call. This is not a high pressure times. No, this is simply a chance to ask each other questions and determine if what we have would make sense for you. Guess not for everybody, but we have to ask each other questions. Understand that I have a big team of practitioners that I work with. So either myself or one of my partner practitioners will be giving you call at a time that you choose. So your next step, click the button around this video, fill out your information, and then we'll grab a time slot that's going to fit with your schedule. We'll call you then, and then we will hop on a quick call and determine if what we have when makes sense. I'm going to leave you with this. I use the analogy, if I'm going from California to New York and I don't have a map, how successful do you think I'd be? I'd be all over the place. I'd be lost. I'd be frustrated. I'd be confused. But if I had a clear blueprint, clear roadmap, a path, that's what we have with thyroid. We've helped patients get this thing solved once and for all without more medications and chemical cover ups. It's a failed model. I can't tell you how many patients have come to me. They dump a duffel bag full of pills on my desk and they're taking the synthetic stuff and they still have the symptoms root cause was never addressed. We can do better. So, your next step, click the button, fill out your information, and we'll talk to real soon. Take care.